So please welcome to the show, Craig, the Obamacare lawyer. Craig Gottwals is an attorney. He is also an expert in benefits and insurance for companies and stuff. So if you have a mess load of employees and you don't think you're getting a great deal, get in touch with them at benefitrevolution.com. Is that your website, Craig?
Yeah, benefit-revolution.com.
Oh, nobody will ever go there. They can't remember it. Anyway, we'll have a link.
Yeah, Benefit Revolution is some defunct deal that doesn't exist. Who knows?
I'm going to distract us briefly, but since you and Joe are friends, you might enjoy this. We're getting several texts that say you clearly have a bear that has been on your porch because deer leave little pellets. And that sounds like a bear.
A bear?
You had a bear eating on your tree and using your porch as its outhouse.
We don't get a lot of bear in my parts.
You're hitting Joe at a sensitive spot there. That's one of his deepest, darkest fears, Jack.
Being eaten by bears. Yeah.
On the other hand, it's a chance to bag a bear and have a bear in the corner of your room stuffed and say, interesting story about this bear.
Judy and I have gone round and round about animal heads in the house. She's not a fan. But if I bag that bear, by God. Anyway, so Craig, listen, for folks who aren't familiar with you, you make your living helping companies understand what the law is. You are not here as a political advocate nor an ideologue. You make your living by telling them this is going to change and here's why. Is that a fair assessment?
That is accurate, my friend.
Okay, good. So what is the latest re the Affordable Care Act, the Obamacare? What is happening? What do you see down the road?
Well, there have been a couple of things, right, with the new administration I have to keep my eye on. The first thing Trump did was he appointed Tom Price to the head of HHS, which I smiled and I nodded. I thought that was a great move. The second thing Trump did was he passed that executive order that basically told all of his agencies, be more lenient in the enforcement of Obamacare. And I kind of thought, well, that's more of a showy maneuver. I don't know if that has any teeth to it. Well, I was wrong. It did have some teeth to it because just last week, the IRS did something pretty stealth and pretty significant. In essence, the IRS changed its forms and its procedures to make it such that an individual can go ahead and file their taxes this year and not state, whether or not they had health insurance. That line 61 that used to ask you, do you have health insurance or are you going to pay a fine? That line is now optional this year.
Why did they do that?
It didn't get a lot of news. Why did they do that? Well, they did it so that individuals can basically get out of the individual mandate yet another way.
Well, what the hell's the point of this? I mean, because the individual mandate is this is how we pay for it part of this gigantic, expensive program.
Right. The individual mandate was supposed to be originally, when this thing was pondered back in 2009, it was supposed to be that. But as you'll recall, for political reasons, the Obama administration realized they didn't want to fine a bunch of their constituents. So they put in 32 different exceptions to the individual mandate and made it such that only a few 100,000, couple million people at the most were actually paying that fine.
Well, it became kind of a stupid test. If you can't figure out a way to match one of those criteria, then you're stupid.
So why did Trump get rid of it? Just because it's dumb?
No, I think Trump got rid of it as a political maneuver to say, hey, look, we're not going to, well, maybe not Trump, but maybe the people advising Trump, right, said, look, we're not going to fine people that don't buy health insurance. And since we can't get this through Congress today, what we can do is we can take the weight of the federal bureaucracy off of taxpayers that refuse to answer this question.
Okay, fair enough. We have a lot to get to, so let's keep moving along. What did the chief of Aetna say recently?
Well, he came out last week and said he actually used the words death spiral. He said, look, we're in big trouble. This thing is not working. Humana had announced the day before they're out next year. Aetna, who's already out in all but 4 states, said we're probably out because, and this is the statistic that caught my eye, they said our heaviest utilizers of Obamacare, our top 1% to 5%, are driving half of our costs in the exchanges. And that statistic should be like our top 10 to 20% are driving half of our costs. So clearly, again, just another metric to show the young and the healthy are not buying it. The very sick are buying it. And so now you're going to see another insurer out, which whether Congress repeals this or not, you're going to have so many insurers pull out of it by next year that you're going to have to repeal it.
Wow.
I mean, it's not going to exist.
Right. Hey, do you have, and I should
That's
ask,
pretty interesting. I don't think most people are aware of that.
Yeah, I'm sure they're not, because it's almost not covered at all in the media. The math behind the thing never worked. But now it's become, it's kind of a farce.
But if you just, like most people, if you're just taking it in through the mainstream media, it's we keep this and it's fine, or Trump gets rid of it because he's mean.
Right. Right.
And you're saying it's
just those two. Yeah.
And you're saying it's over no matter what soon.
Well, that's what I just think about the first 2 points we've hit. A, the IRS is going to make it optional for you to say whether or not you have insurance. And B, there's going to be many, many counties in the country that don't have an insurance option available in the exchanges, i.e., it's dying.
Wow. It's dying from both ends. I mean, because the young healthies is the only way you're going to pay for that 1% to 5% that are half the costs. And now you've told them you don't have to sign up at all. So it's practically been abandoned. You know, the previous administration made a lot of noise about how many people were newly insured, but the cost per person was amazing. I mean, it was huge per person. You could have just given them like a fraction of that money, and they could have paid for insurance for the rest of their lives. Is that an exaggeration or what?
No, that's exactly right. I can't remember the exact number, but it was something like a minimum of $50,000 per year per person, or some crazy number, which we could have all. I mean, you could buy insurance for an entire family for $25,000, and that's a really rich policy.
Right. So, the federal government moved in and did it bloated and expensive and inefficient. There's a shock. I know.
Hey, that leads us right to our third point, Joe, the federal government's efficiency. Again, what does a geek like me do for fun on a Monday morning? Well, I was reading the latest Congressional Research Office report on Obamacare, and it happened to be looking in detail at the numbers of people that got exchange dollars in 2014, and I thought this was great. So only $3.4 million actually got exchange subsidies in 2014.
3.4 million people.
3.4 million people, yes. Now, 1.5
in the whole country, 3.4 million people are actually using the whole point of Obamacare.
Yeah, so
wow.
That particular year, there was 8 million people covered. The rest of them were kids that stayed on their parents' plan longer. So then they say, 8 million people are covered in 2014 due to Obamacare. It was kids that stayed on their plans and the Medicaid expansion, and then 3.4 million who actually got Obamacare.
Who got subsidies and bought insurance in an exchange.
Right. And of those, this is the part that I love. In those subsidies, 1.5 million of those people got too little money, and 1.8 million of those people got too much money, meaning only 60,000 enrollees actually received the right amount of subsidies. Because of the way we do it, remember, you have to kind of estimate what your income is going to be and then settle up at the end of the year. So what that means is we devised the system that only provides the accurate amount of subsidy to a taxpayer 1.8% of the time.
Very nice.
So it's what's clear. What's always been true and is more clear now than ever is when we all talk about Obamacare in the media, not you because you're really into the weeds on this, but just in the general media, when we're all talking about Obamacare, we're just talking about our healthcare system.
Pretty much.
In general.
Yeah.
Because the Obamacare is such a tiny part of it.
Craig Gottwals is on the line. Craig, the Obamacare lawyer. Craig, I'm sorry. I need to put the whip to you just because we're running out of time. You had a statistic, and, when you get a chance to maybe study a couple more states around the West, that'd be great. But I know you do most of your business in California. So what can you tell us about Cal Unicornia and Cal's version of Obamacare?
Well, Calitopia is a perfect indicator for the rest of the West and both coasts because we are the socialist leader. When we talk about the need for Obamacare, we needed Obamacare because we needed a safety net, right? Well, that opens a discussion on what a safety net is. Do we have a safety net or a safety hammock? Because 31% of residents in California are on government-provided insurance for the poor, and that would be either CHIP, which is for kids, or Medicaid, which is for adults and kids. So in our state, without Obamacare, 1/3 are on insurance for the, quote, poor. So we passed Obamacare because we need a safety net when we already had 1/3 of us on our safety net. Now, if you want to look at the overall socialization of healthcare in California, recall, and I think we talked about this on your show maybe 6 months ago, if you add together TRICARE, Medicare, And state and federal workers, you get all taxpayer-funded health care in California. A mere 70% of Californians are on taxpayer-funded health care.
Wow.
Wow!
Wow, that is just amazing.
Wow, how many people know that? Not very many people.
So are we just stupid for continuing to advocate for smaller government because it's over, or what?
At least as far as health care goes, it sounds like it.
Yeah, well, I suppose so. All right, then I'm stupid. That's not the first time, that's been communicated to the show. So, fair enough. Wow, Craig, thanks for the update.
No problem, gentlemen. Thank you.
All right, yeah, we'll talk again soon. And again, if you need help with that sort of thing, benefit-revolution.com.
Wow, so the conversation that's being had in the, among us, those of us who aren't really into this, just mainstream media, that sort of stuff.
Yeah.
It's so inaccurate in so many ways.
Oh, yeah.
The Obamacare, we're all just talking about our current health system. Mm-hmm. And how it has been affected by that tiny little sliver of people that is the Obamacare thing. And then at least in California, and I don't know how it is in other states, the vast majority of people have a different system anyway.
Right. And listen, I'd like to say, particularly to our liberal listeners, this is not cynicism about your goal. If your goal is to make sure poor people can get health care, and that people who had cancer or have cancer can get health care and insurance and that sort of thing. This is not cynicism about that goal, but Obamacare may be it almost certainly will be the greatest example I ever see in my life of something's got to be done. This is something, so this has to be done. Obamacare was an elephantine, bloated, doomed, illogical, inefficient cure for a fairly modest problem. And it's more or less dead.
Yeah. And then can the Republican Party, since it's in charge right now, come up with something that's better?
Oh, yeah, it's not an easy
better.
nut to crack.
No.
And